If 911 isn't coming, your family's survival depends on you and you alone. Do you know what to do? Do you know how to react? Do you have enough training and confidence that you can take care of your family no matter what? In a real emergency, the first 3 to 5 minutes determines who lives and who dies. Hey guys, how's it going? This is Dan from Dozer Rescue. And in today's video, we're going to be talking about the top 3 medical skills that I believe every man needs to master, especially to take care of his family. Before we get into it though, I do have a quick disclaimer. This is a video for educational purposes, and this should not be a substitute for professional medical training. If you really want to master these life-saving skills, then I highly recommend that you go to a proper hands-on training course from a certified medical professional. These courses are like Stop the Bleed courses, the American Red Cross, American Heart Association, or if you're involved in the military or some form of tactical team, you have courses like Tactical Combat Casualty Care and things of that nature. Go ahead and get certified and trained on those programs and those skills, and then you can use this video as a supplement to help you out. With that being said, let's go ahead and get into the very first skill. So the very first thing that I feel that every man needs to master is how to stop severe bleeding. So you can bleed out in as little as 2 to 3 minutes from a major wound, and that is much faster than the time an ambulance can actually get to you. There's a variety of factors. And so you can't always rely on someone else. You need to be able to take responsibility into your own hands to take care of your family. Massive bleeding is the #1 preventable cause of death in trauma. And if you have a major artery that is cut, for example, you have a femoral artery, you have a brachial artery, you have less than 3 minutes to stop the bleeding. And most people just think that they'll just put some pressure on it and that'll be good to go. But that's simply not enough. So let me walk you through the steps of how we can actually stop severe bleeding. The first thing is you do want to apply direct pressure, but it depends on where it's at. So let's break it down. If you have a wound on yourself or a loved one and it's on an arm or a leg, a limb, you want to typically use a tourniquet. Your tourniquet is going to be your best option. It's going to be the most effective option. And how that works is you want to take your tourniquet, you want to place it about 2 to 3 inches above the wound, and then you want to crank it down and make sure that everything is secured into the point of where the bleeding stops. If you don't see the bleeding stop, and for a fact everything is tight and very secure, you can go ahead and apply a second tourniquet, either high and tight, or if you didn't do 2 or 3 inches the first time, you can apply it 2 to 3 inches above the wound. And that will almost definitely stop the bleeding. If it doesn't stop the bleeding, then there's other methods that we can go to. But for this video, we're just going to talk about the tourniquet. Again, you want to crank it down, make sure everything is as secure as you can possibly make it. Make sure it's on the right areas, either 2 to 3 inches above the wound or high and tight, meaning in the growing area on the leg or in the armpit area on the arm. When it comes to any other injuries, you're going to have to resort to wound packing. And this is going to be for junctional areas. So if you actually have an injury in the groin or in the neck, there's profuse bleeding, you're not going to be able to get a tourniquet on there. So what you can do instead is you can use gauze, but something that I always recommend, and I do recommend for you to pick up too, is going to be something known as quick clot. And what quick clot is, it is a hemostatic agent, a hemostatic gauze, where basically it's normal gauze that's impregnated with a hemostatic agent. And what that does is that basically helps the blood to coagulate and helps the coagulation process, so it helps that bleeding stop. And so what you're going to do with that is you're going to use that and you're going to shove that deep into the wound, and you're going to apply pressure on top of that and hold that pressure on there, very firm, hard pressure. And that will help stop the bleeding as well. Now, if you want more information on this, I do have a video specifically about the tourniquets. And of course, more videos will come out in time where I actually go over each one of these skills individually and really go into details in depth to help you understand more and actually show you and train you. Pro tip is when it comes to the tourniquets, I know it's very tempting to just buy a quick $5, $10 tourniquet off of Amazon or a variety of places online. But I will advocate that if you're going to buy a tourniquet, and I always recommend the combat application tourniquet or the CAT tourniquet, just because that's all I've ever used. And that's mainly what I'm comfortable with in real life situations. The CAT tourniquet, it needs to be from a reputable source. What I recommend is North American Rescue. Do not buy a cheap knockoff tourniquet from anywhere else, especially if it's a Chinese made company, because they tend to be cheap and they tend to not work. And for a North American Rescue tourniquet, it's about $30, $35 on average. If you look at it, if you're paying 30 bucks, 35 bucks, I feel like that is a very worthy investment to save someone's life or the potential to save your own life. So, what I'm trying to say here is don't cheap out. Buy a reputable brand, a reputable source. And what I always recommend is North American Rescue. Their tourniquets are used in military applications every single day, all across the world, law enforcement, fire, you name it. Just do yourself a favor, get a quality tourniquet. And also practice using one-handed applications as well. Since you are the first responder and you need to take care of your family, you can't rely on other people. If there's no one around you to help you out, you also need to make sure that you can save yourself. Practice one-handed application of the tourniquet. Practice putting your own tourniquet on your arm, your own legs, tightening down, trying to stop that pulse to make sure that you can stop that bleeding. That's a really important skill to do. I have another video. If you want more information on that, check out the link down below, and I'll take you to another video where I explain more in depth about the tourniquet. Okay, so let's go ahead and talk about our next topic, and that's going to be how to treat a sucking chest wound. Now, what is that? So basically, if someone takes a bullet, if they take a stab wound, or they get impaled in the chest, you can't just put a tourniquet on there, and you can't exactly just put gauze on there and call it a day. So what that is, essentially, if air is actually building up inside of the chest and it's crushing that lung. And so if that goes on for too long, it's untreated, that person will eventually end up suffocating to death and dying. So what we can do is we can take something called a chest seal, a vented chest seal. The brand that I'm going to recommend for this specific seal is going to be for Hyphen chest seals. And so what you're going to do is when you do have that hole in the chest and you can see that the victim is obviously in trouble breathing, you're going to take that and you're going to put that onto the chest. And what that vented chest seal is, it basically has adhesives and it has a vent so the air can escape out of it, but it also prevents air from getting sucked into it. And so you put that onto the hole, it's adhesive, it sticks on there, and that is going to help stop the pain, help stop that crushing and stop that air from being sucked in. Now, one thing to note though, is that you also need to check on the back. So if you do have a loved one who's been shot, for example, and they're having that trouble breathing, you identify it, you need to put a chest seal on the front as well as on the back because bullets enter and they exit. So if you only do one on the front, you're doing yourself a disservice and it's not really helping out because you typically are going to have one on the back. If you can try to position the victim upright, it may help them breathe a little bit, or you may need to adjust them onto either side. Whatever helps them to breathe easier, do that for the patient. You're going to have a lot of pain. You can also check for like bulging veins in the neck, and kind of a later sign or symptom would be a tracheal deviation, which is basically this right here. Your trachea is going to be pushed off to the side and it's going to look ugly. That's more of a late onset. Again, that's not going to be something that you're going to notice right off the bat. You just want to look for, again, if there's a hole, you're going to know if they got shot or stabbed or impaled. And so you need to act quickly and put on that chest seal to help stop that air from coming in. If it does get worse, basically you will need to do something called a needle decompression, which is also known as darting a patient. Don't worry about that. We're not going to go into that for this. So don't try to stick needles in anyone's chest. That's not what we're going to do here. And finally, for number 3, we're going to talk about just some real basics for CPR. Sudden cardiac arrest kills more people than any kind of gunfight or car accident or fire combined. If you freeze up and you don't know how to appropriately respond for CPR, you could lose that person right in front of you because you didn't act fast enough. And that's one thing that we need to do as leaders of our family is we need to be able to take that responsibility and take action quickly so that we can save their lives. We need to be responsible for that. So basically, when it comes to the CPR, the reason why it's so important is because when the heart stops, the brain actually will start having damage, start taking damage at about 4 minutes due to the lack of oxygen and lack of blood flow. And so death can occur in as little as 10 minutes. And the truth is that most guys haven't practiced CPR since high school or since the last job that they had that required them to, and then they never do it again, especially hands-on. And so that's why we want to go over this and just do a quick refresher because it is extremely important and it can save anyone's life. You could be out at a restaurant and someone could collapse in front of you and you check their pulse, you listen for their breathing, and if those are both absent, you get straight to CPR. So when it comes to CPR, we just want to talk about the compressions. So we want to keep 100 to 120 compressions per minute. Most commonly, people will say to think of the beat of staying alive. So if you can think of that song, think of that beat, you're going to be okay as far as your compressions. And you also just want to make sure that you're pushing hard and you're pushing fast and you're pushing deliberately. So you want to make sure that you're at least 2 inches deep into your adult patient. You want to make sure that your hand placement is like this. You want to use the palm right here and you want to push that into the sternum right here on top. Typically, what you can do is if you have your hand there, you want to line your middle finger with the nipple of the patient and then you push down like that. If you don't know what to do and you're in like a facility or a public setting where there's first aid kits and AEDs available, then your best bet is to get an AED. So you want to take an AED from the wall. An AED is an automated external defibrillator. And so you're going to take that, you're going to attach the patch to the patient, turn it on, and hopefully you can just zone in and listen to that AED and nothing else because that will guide you through and walk you through the whole CPR process. It will tell you the compression rate. It'll give you a little metronome or a sound so that you can continue to hit your compressions the right time. It'll tell you exactly what to do from there. And hopefully by that time, first responders or an ambulance will finally show up, firefighters will show up, and they can take over from there. If you don't have an AED, you just get straight to your compressions. Do your typical 30, give 2 breaths if you're by yourself. If you have someone else with you, have them help you. But again, this is going to depend on your county's protocols, the training you received, all kinds of things. But the most important part here that we're focusing on this video, get trained up for CPR, take a class, and just remember, you want to have that 100 to 120 beats per minute. You want to push hard, push deliberately, get at least 2 inches in, and acting fast. The faster you act and the faster you get on CPR, the higher the chance of survival for that patient. And if you have an AD available, even better, more power to you. I would also just recommend too, if you are going to go through the trouble of getting your CPR, you might as well go through child and infant CPR. I cannot tell you how many times, even with my own child, choking has occurred. And going through a class like that, child and infant CPR, not only do they teach you the CPR, but they also go over rescue breathing and they go over choking and all that stuff. As a father myself, I just think that it is incredibly important to go take. I think it should be mandatory that all parents go and take these courses because it's going to prepare them to help them when their child does have an issue. And God forbid that the child does go unconscious and their heartbeat stops and they stop breathing, they can do something about it instead of just freaking out and crying or waiting 10, 15, 20, 30 minutes until an ambulance arrives. So be proactive, take yourself a CPR course, get certified in adult, child, and infant, and it'll just make you that much more of a prepared parent and it'll just help give you that ease of mind. So now let's go ahead and talk about some improvised medical gear. Now, this is something that is absolutely you have to do last minute. If everything hits the fan, this is your last alternative. But the point of me making this video and talking about these topics is I'm trying to help prepare you guys, get you in the mindset of being ready and staying ready. So go buy the proper equipment, go get the proper training, do all that stuff ahead of time so that you're not having to get into these improvised items. But nonetheless, let's go ahead and talk about them. If you're talking about wound packing, if you don't have anything available to you, you can use tampons and you can use maxi pads. Is it going to be as nearly as effective as hemostatic gauze or quick clot? No, but it may help you in a pinch. When it comes to the chest seals, if you don't have an actual chest seal, you can also use duct tape. You can use Ziploc bags. Basically, you rip the Ziploc bag open, you put it on the hole, and you're going to tape 3 sides and leave one side open to vent. Again, if you have to, but try to just buy the actual equipment and just use that instead. If you have small cuts, you can always use super glue. Not something for anything massive or big, but if you do have a small cut on your arm, you can just pinch and squeeze the skin together and use some super glue, and that'll try to hold that together. If you're coming to a crossroads and someone's bleeding out from a limb and you don't have anything available to you, you can use a belt. It's not the best option because they typically don't get tight enough, but if it's something you want to try, you're more than welcome to, especially on a last ditch effort. So you're going to take the belt, you're going to tie it around high and tight, or again, 2 to 3 inches above the wound. Crank that sucker down as tight as you can possibly get it there with the belt loop or the belt hole. So you're probably just gonna have to hold that pressure there, but it may help you. And again, you're looking for the bleeding to stop. That's the sign you're looking for. So those are some improvised products, items. Again, I'm not really recommending to go out and do that, but what I am saying is in a pinch, you need to have knowledge of how to react and how to improvise, and that's something that you can do if you come across any of these situations. So, with that being said, those are the three most important skills that I believe will keep your family safe, keep your family alive, and that all men leading their families need to master. You become the first responder. Don't rely on anyone else. Take knowledge, take preparation, take that responsibility into your own hands, and take care of your family. Do what you need to do. I challenge you to sometime this week sit down with your wife, sit down with your kids, talk about these things, go over a plan, talk about, hey, we're going to go and do this together. We're going to do a practice scenario together and run a medical drill with your family. I think it's really important and it'll do something fun. It'll make it interesting for you guys, but you'll also be able to practice something for real. So when it does happen, you're not shocked seeing it for the first time. Go ahead and subscribe to my channel for more tactical family preparedness. If you guys are also interested, please check out. I have a free guide for you. It is the Tactical Family Preparedness Gear Guide I've made. Basically, I list out the top 10 emergency preparedness items. So as you're starting your family preparedness journey, check that out. It's for free. My gift to you. It's in the channel's description down below. Go ahead and click that link. Thank you guys for your time. I wish you guys the very best. I'll see you in the next video. Take care, stay safe, stay prepared, and stay tactical. God bless you.